All right. So here we go again. This has been going around, making the rounds. Some serious rounds too, right? It says here, the memo. Kindly be advised that Cabinet on Wednesday, 27th July 2022. At first, I thought it was a hoax when I saw the date, but directed that all healthcare workers, as defined in statutory rules and orders number 28 of 2021, must be vaccinated against the coronavirus disease 2019 or COVID-19 and must receive boosters at 5-month intervals after an initial 2-dose series of an approved vaccine in order to be eligible for employment in the health sector. Please be guided accordingly. Ooh, so this is not just... Yeah, please be guided accordingly. No, you will be deemed to abandon your job. Get out, leave. I mean, just like we went through the first one. If you did not take your vaccine and they gave us an ultimatum or gave the workers an ultimatum, you have to get it by a certain time. That was even extended, just to give people, I feel like it was extended twice, all thing, just to get that full dose, which is 2 doses. Now, I think there is an error in this here, right? And unless, of course, we are out of the Sputnik vaccine, it says you must receive boosters after an initial 2 dose. I know you could take, and they were telling us all the time, you can take 1 dose of Sputnik and be considered fully vaccinated with Sputnik Light. They told us that. So I don't know if that is an error. I mean, I think it's an error because it should read after initial 2 doses or a single dose of an appropriate vaccine or of an approved, and so on and so on and so on. Like, did you know that Sputnik is still not approved by the WHO to this day? Sorry about that. Sorry. I thought I pressed that button.
Mm-hmm.
To this day, 2 years in 2019, 2021, 2022, and we still, like the rest of the world, rather.
Russia still making vaccines?
Why not?
I mean, you're all out in a war.
That don't mean they can't provide other things that are necessary for their survival, right? But let's discuss this for a bit. How do you feel about it says all healthcare workers being required to take a booster shot at 5-month intervals?
I tell you can fire me.
Or you could just walk off the job.
Whichever. Nah, fire me.
Why?
What?
But there's some fine prints in there, on how they are going to go about doing that. I feel like, just so that they wouldn't have to be dishing out so much money. But I have a question, right? And I'm just gonna ask a few questions, just for argument's sake, right? Question number 1 is, who's complaining? Do the healthcare workers have a real problem with having to take a 5-month booster? You take a booster shot every 5 months since your initial shot, your second dose. And I feel absolutely certain that they have gone beyond 5 months since they took their second shot, their second dose of the COVID-19 vaccine.
As another thing I was studying too. Some of us, we hardly survive. Well, yeah, quote unquote survive the effects of the vaccines. So you really want to open each other again?
The next time around, it wouldn't be as bad as the first time, as in physical response to the vaccine.
Yeah, but then exactly, but then
survived.
But then your trauma response don't gonna be like, nah, I ain't going on with this again.
But you are a healthcare worker. You are in the system. You will have seen people die. You will have seen people become hospitalized. You will have heard the countless stories about COVID-19. And there are countries like China shutting down right now because of further spikes.
Yeah, well, that's China.
Yeah.
Alan, you could stop comparing outside with here, so
Why not? Why can't we?
Because we don't have the numbers that China have.
As in the population?
Yes. The higher the population, the more you go transmit.
Okay, so all right, so let's look at our numbers. Our population is 110,000 people. The last report coming from the Ministry of Health, Wellness and the Environment says that the number of active cases, PCR and rapid antigen, lies at 45, right? Hospitalized 8 people, right? So there are 8 people using up resources that are ill enough that need to be hospitalized.
Are those 8 vaccinated people or 8 unvaccinated people?
Unvaccinated people.
Okay, then.
Right? The total deaths as it stands right now, recorded 115 per 110,000 people. So that's 1%, thereabout, right? In terms of vaccination, now first dose 37,039. Second dose 31,166. Boosters 4,054. So what you're saying is that we're not at a stage where it is absolutely necessary for the healthcare workers, you know, that are seeing people whose systems are compromised, are already compromised.
So what you're saying, right? That the same healthcare workers who are against the vaccine, they end up and took it. So now they had to go back and do the 5 months thing. That's what you're saying.
Everybody who's working there would have already, based on the statutory rules and orders, already fully vaccinated.
You really feel so?
So how you gonna be working there and some people get to lose their, so not get to, some people lost their jobs.
You remember the whole fake
I think
vaccine card thing.
By now they don't catch everybody who was doing that, and by now I feel as though the Ministry of Health, they have already done what they needed to do to deal with that issue. I mean, 2 years into it and you still can't. I don't even think that's a proper argument right now at this stage.
Man, I honestly don't feel like we need a whole 5-month booster thing. We could do what exactly? What is it going to protect from?
So obviously, right?
We still fighting about COVID and
why not?
And you have what we call it going on.
It's something.
You have monkeypox going on and you want to fight about COVID still.
Okay,
really?
so a lot of diseases are out there. We still have to fight up. We still have to fight up with HIV/AIDS.
But
we fighting up. That's why we're giving children vaccines.
But then you said right, COVID is just like a little cold. No, remember that?
I say when I said like a little cold, I mean in terms of having to live with it, right? Not necessarily the degree of illness and the body's response to COVID-19.
How much people does from cold and flu?
I don't know.
Okay,
they don't give us those figures.
Down here.
I don't know how many people die from flu here.
Exactly. So then, if it's like a little cold and stuff, and nobody don't die.
But 115 people died from COVID-19 here, Lano.
Those are people with underlying issues.
Not all. Not all.
The majority, right?
I can't say majority, minority, equal, but not all people, all the folks who died from coronavirus in SVG, from the time we started recording, died because they had underlying issues.
Yes.
Not all. Not all.
Go
back to all the reports from the Ministry of Health.
I don't remember hearing anything about anybody
all.
That.
Because we were so hooked on people with underlying issues that that's all people were talking about. You wouldn't remember what you were not focusing on.
What is the focus then?
Is you are supposed to ask, what was your focus? You're saying everybody will die from underlying thing. So people with compromised systems, they're the ones who are most susceptible to dying from COVID-19. Okay, then. So what if there are some people who are working in the healthcare system with that?
Fine. But if you get vaccine, you're going to dead from it still, right?
The probability is significantly lower based on the figures, based on what they tell us. Significantly low.
I disagree.
This sounds familiar. You disagree.
Yes, it sounds very familiar too.
Opinion, but that's your opinion, right? I could go based on what they tell us, one, and I could go based on the figures that are out there. Over 6 million people died from COVID-19. How many of those people were fully vaccinated? How many of those people got boosters?
You see, this is where our problem is. We compare ourselves with outside.
Yeah, but is the outside germs that come in here, so why not?
Yeah, but the outside germs ain't affecting us anymore.
Anymore, Lano. You see the amount of people in the hospital right now?
What, 8%?
Yeah.
People in the hospital every day. So
Yeah,
what does
but
that say?
we're talking about COVID-19. We're not talking about like any and anything. It's COVID-19,
Uh-huh.
right?
Your point.
I mean, my point. I'm saying that
But-
you are just ignoring.
But I'm saying that people in the hospital every day. So what is the big issue?
We're just like trying to get out of a pandemic. I don't think that you have forgot. You have forgotten. You have forgotten how serious it
Fine,
was.
you want to get out of pandemic, right? And then you keep bringing back pandemic stuff in the face.
Yeah, but it's risk. You assess the risk right now. If it is that there are other countries that are still struggling with it, everybody's traveling right now. What is so wrong with just getting a booster?
What exactly is struggling with?
What?
What exactly are we struggling with?
I said, if
take-
it is that people are struggling to curb the spread of COVID-19, like what is wrong with people who are already fully
Yeah,
vaccinated
but nothing-
getting a booster every 5 months?
But nothing happening here, so where we going curb?
Okay, so nothing is happening here, right?
Go ahead.
So scrap this argument. Let's move on. Because nothing is happening. Why are we talking about it? Why are they sending out memos? Why are they making it mandatory?
Right.
Why are they going on and on and on about rehiring and the statutory rules and orders if nothing is happening? So let's just y'all SVG Health, y'all start posting things, the updates, because nothing is happening. All right, according to Lano, nothing happening. So just leave it.
How many? Check back the page, right? And how many cases did we have the last week?
I tell you what the last report was. Like, you did not hear me. I
No.
said 45 active cases.
The week.
I go back and count the whole week for. Why didn't tell me so before? It's not
Check
gonna add up everything.
You check the week. That is cases add up overall. Just check the week and see how much figures coming out every day.
That don't matter.
Me, it don't matter, the figures getting lower and lower.
Obviously, because people are recovering.
What they recovering?
Yes, they are recovering.
So basically, it don't pass through everybody. That's what it's saying. That's what I gather it.
Okay, well, that's you. Well, you don't get a booster. This is not for you. I see that's the problem too. It's not for you. It's for the healthcare workers.
You want me to go fight up a booster. You don't even know the kind of effects I had the last time.
So then tell your boss, speak to your boss about it. Tell your boss, I can't take no booster.
And then the boss came after me.
It's not the boss who wants to fire you.
So
Those are the rules. Those are the rules. That is the law.
So you're going to put me out of work because of vaccine. Suppose I hold a very important position this
And
morning.
you just get
If
replaced.
if I hold an important,
What if you die? What if you die on the job?
No, you can't replace them kind of labor. Somebody with
Excuse
a important
So
position.
if worst case scenario, a person dies with a super important job, what is gonna happen? The whole place can just be at a standstill. Is the same thing? Just get a replacement. You don't. We have gone through this already, right? We have gone through this already, and for argument's sake, you are working within the system, so shouldn't it be an easy? All right, cool. All right, no problem. Just just
Right. We working in
Put
the
it right-
we
put it
working in
right
the system,
here.
right? But the system should already see what is happening. It is no longer as potent as before. So why
says who? Are you the
the
Ministry of
numbers
Health?
already?
Are you the
You said
Ministry
bring
of
up the
Health?
numbers just now, Dee.
I brought up the numbers to tell you that we are still having people who are infected with COVID-19.
Watch Carnival come and go, Andy.
Right. So here's something, right?
Right.
Everybody reporting that they're sick with COVID.
Just wait, hold on. How much vaccinated people in Carnival?
What do you ask? I don't know. And we will never know that figure.
Okay then. But regardless, right, it would spread with or without the vaccine, right? No, yes?
Why do you think that
You're ignoring the question.
yes?
Okay.
Because I find that is an answer that I shouldn't even have to give you.
But then look at Carnival. Nothing happened during Carnival.
Who says nothing happened during
What happened
Carnival?
during
Who said
Carnival?
that people can just stay home and just and take a little Setamal and just go by their business?
The number should have been fine, even if, right?
That's if they were reporting that they were ill. Remember, even during the heights of COVID-19, people were staying home. That's how some people end up dying, People were staying home, being ill, not going to the clinic, not calling the hotline, not telling anybody anything. Until it was very late, then you had to get ambulance to come for you, the full PPEs and what's not. because people were just not going. Even now,
You wanna know why? Because you remember, right? Remember they brought out a table and say what to look for in COVID and what to look for in common cold. Remember,
Right.
remember they was similar, right? So now I go say, okay, well, yeah, I had just common cold. I get over it. Could be COVID, could not be COVID. But the point is to get over it.
right, so which means that there could be one COVID-19 case or many who did not report just because.
Numbers don't lie.
All right, some responses. Good morning. So for their entire working life, they have to take this. Why? I thought the vaccine wasn't mandatory anymore. This is wickedness. I hope they protest against this. Stop forcing people to take the vaccine. I think Crystal is arguing based on the data provided, and Lago argument is based on what he thinks. Let's get a voice note here. Da-da-da-da-da.
Good morning, Lana. Good morning. Lana, I love how you every how Crystal come this morning, you have an answer. I'm enjoying it. You're shutting she down every time she come. I understand the argument. But Crystal, you have a point, and Lana have a point.
Mm.
You're talking about vaccine and they had a big carnival the other day. Really? Vaccination people there around people who wasn't vaccinated. Hold on, Lano. You're on top this morning, boss. Good morning, St. Vincent.
Pet me and you in front again. Boo. The argument is not between vaccinated and unvaccinated right now, you know. It is super vaccinated and regular vaccinated. Could you imagine that?
Super vaccinated.
No. I am going to ask.
Right. All right. Okay. And even though, right, I'm not hearing about the vaccines anymore. No? As in, like, you know, if they're still here, if they
You're listening?
if they
Baba, you're not
expired,
hearing.
if
You're
they
listening?
expired, if they expired, if they close the expiry, so we'll say why you take vaccine because they close the expiry. And you just bring up that they know.
But how others really look at the Ministry of Health? Like a dog show? Like a mobby shop? I think this is, oh my gosh, look, the vaccines are about to expire. Let's change the law. Let's change the rules. Come on, man. It's the Ministry of Health. This is national health right now.
National health.
Yes, sir.
All of us healthy because
Me like that argument, yeah.
because if you be healthy, if we wasn't healthy, cases would have been higher.
If we were what?
If we were not healthy, cases would have been higher.
Man, they have healthy people who run up and down, who exercise and everything, drinking 8 glasses of water and drinking lemon this and that, and still get sick. That don't mean nothing. It means like you're probably less likely too, but it doesn't mean that you are 100% exempt from getting ill with anything at all.
Because
People
of
still get
vaccine.
sick. I feel like that was a general statement, so I'm responding generally.
The point is, you're going to get COVID whether or not you take the vaccine. We're going to prepare to the vaccine again, fam.
Okay, so it's a personal choice. So you don't take it. You don't take it. All right.
All right.
If you were working in the healthcare service, you would not be at work this morning.
If I be working in healthcare, I don't turn up already.
Oh,
I
Lord.
get recognized.
Okay. Let me read another response. Good morning, X. Can you tell me what's really going on with this man and still dictating people on the job? Were people fully vaccinated when he had carnival? When he and his convention were people, when he had his convention, there was no D there. The D went somewhere else. Were people wearing masks and vaccinated to enter the convention? This is total garbage. I say, get rid of them. He too wicked. Man, give me a break. I mean, this is not vaccinated versus unvaccinated, you know. It is for the healthcare workers. Who vex? Who most vex? People who are not working within the healthcare sector,
People who work
or
in
people who are working there. 2 more minutes, 1 more minute, and then we're gonna sign off.
Honestly, if I was there, I wouldn't gonna leave. I'll get fired. Because we don't go through this argument already, and I'm not going through it again.
For folks who are saying, and we just went through the same argument that you said we're not going through again. All right. For folks who are saying, what is happening with the rest of the world? You know that there are actually other like states and countries that have made it mandatory for their healthcare workers to get booster shots. My question is, how come it took us so long, right? If CDC said boosters should be taken every 4 months. So that is
You see that the other thing again. First it was 6 months. Now it's 5 months.
at least the recommendation from the CDC. So we gone out to carnival, we got back to health now. The recommendation was every 4 months you should take, at least every 4 months you take a booster shot. Our government has said 5 months, right? Now 1, 2, 3, 4, 4 trees are 12. So you're supposed to be shotting up yourself 3 times a year. Question, right? Really and truly. And I realize you did not ask.
Go ahead.
Right? No, my first part was for argument's sake. Right? I'm gonna help you out with
No,
a
you
few
go ahead.
questions,
I
right?
hear your question.
How long are we supposed to continue? At what point are we going to get to the point where the risk is so low that we no longer need the statutory rules and orders? So how long are our healthcare workers supposed to take the 5-month booster shots?
Right.
Right?
I was actually going to mention it, but not ask about it. I was going to say, if they say, okay, well, fine, maybe we could take one a year. You know, that could be okay.
And like the flu shot in the States and other countries.
Right. But you can't tell me again choke on myself every 4 months.
Right? Another question to ask. Is it going to be extended to other ministries? Like the teachers.
And public sector and whatever.
I think it's up to the public sector to decide whether or not they want to make that mandatory for within their business place. Is this going to now spill over to just like as soon as the government said yay, the private sector said, all right, let's go with it, because the government said that, it's okay. So now we are making it mandatory before you can even get a job or stay within the job that you already have.
But my
you have to get the vaccine.
My question again, too, right? Why all of a sudden, where this come from all of a sudden? Is it you studying outside, or is it because of something happening here?
They have to know. They have to have advice from
happening
PAHO.
here.
That's
Nothing
probably what
happening
you
here,
think, right? PAHO. What if our cases are so low because of the number of persons who are already vaccinated? So there's no major super spreader because we have 31,000 people.
The number's low because it probably don't go to everybody's system already, and you don't build up an immunity to it.
So there's natural immunity and there's man-made immunity. So when you add the two together, maybe that's why our figures are so low. Yeah?
No.
Yeah? Morning, Jimmy. Jimmy, you're late for class. We're going to stick up in here, come back with some more responses, and head on up to the top of the hour. What time is it? It's now 6 minutes on to the 8 o'clock hour. Thank you for joining the live at Extreme 104 SV.